Weiler, and welcome back to week 8 of Shine in 2016. Last week, we were reminded of all the healthy ways that you can live better in better muscle balance. And Joanne McKinney was terrific. If you haven't seen it, you can look in the archive. And today, I hope you're feeling a little bit more connected to your posture. I know I am. I've really been thinking about sitting on the sleeping giant, my butt, as she mentioned, and really noticing the ways that you can engage your core, even if you're working at your desk all through your day, just small ways that you can make those changes. And today we're going to deepen the knowledge that she started for us with a true sense of ways that you can really activate your inner athlete as you're learning ways today about how you can meet your fitness goals, live better in your body, and just take advantage of what we know now in science in terms of sports medicine. So Dr. Jim Bovard is a sports medicine physician, and he's in family practice on the North Shore in Vancouver. He is the leading physician for Sports Med BC, as well as the team physician for our Canadian Olympic team. And he's also the Vancouver Whitecaps soccer team as well. And on top of all of that, he is a husband and father and a really dear friend. And I just want to start by reading just a little thing from the Buddha. And I've gotten into this habit with the series of adding these little poems, and it kind of sets a context. Anyway, the Buddha says, "However young the seeker who sets out upon the way shines bright over the world, but day and night the person who is awake shines in the radiance of the Spirit. Meditate, live purely, be quiet, do your work with mastery. Like the moon, come out from behind the clouds, shine." And Jim is one of those people that I believe is a master in medicine and just in human sciences. And he really walks the walk. He lives what he preaches, and he's just loved by his patients and just a total resource in Vancouver and probably in North America for sports medicine. So welcome, Jim. It's really great to have you here.
My pleasure, Joanne. Looking forward to it.
Yeah. So, I'd like to kind of know, like, what inspired you to become a sports medicine doctor? Because you started out in family practice, and I think you're still doing family practice, but you specialized at a certain point. And what was the inspiration there?
Probably first and foremost was an interest. I mean, I enjoyed sports medicine. Secondly, there was a need on the North Shore. The individual who was doing sports medicine for the North Shore wanted to go into more an academic route, and she left and moved over to the university. So it just was, and my love of sports. So it was sort of a combination of an opportunity, a desire recreationally, that all came together. Family medicine involves a lot of musculoskeletal medicine anyways, and sport medicine in particular, I think, is a skill set that every family physician needs to have a certain amount of knowledge. And although our training system is very poor at preparing them for it, which is something I'm working on to try to change. And the final thing that led to it is my good friend, my two mentors, Doug Clement and Jack Taunton, gave me the opportunity to come and train under them for a year, and so I couldn't turn that down. And it was a great new adventure back in the mid-90s when I did it. And so it all started out with that desire to take care of our North Shore weekend warriors and regular athletes, which is a little bit of a different path than many who go into sports medicine go into it for, or they think they're going into it because of taking care of elite athletes or professional athletes or Olympic athletes. But really the core of it is you and I and the weekend warriors, the young developing athlete, the recreational athlete, and us aging athletes. And that's the bulk of the work that I do day to day, although, as you mentioned, I have a portion of my practice which is focused on the elite professional and Olympic athlete.
Yeah, and I think you just came back from Japan traveling with the Olympic team. Am I right?
Korea, yeah. The 2018 Olympic Games are going to be in Korea. So the normal cycle in Olympic parlance, we always talk in terms of quadrennials. Everything happens in 4-year cycles. For example, I take care of our endurance athletes for the summer games, so they're in full-on stress, anxiety, prep mode because the Rio Games are only 5 months away, and some of them have qualified and are trying to get ready. Others haven't qualified, so they're under stress trying to qualify. For the Winter Games, we're 2 years away, so we're at what's called the test phase, where you go and you do test events. It allows the host country, we did it here in Vancouver in 2008, 2009, and they are doing it there, so they can test out their systems of preparation for hosting an Olympic Games. And as the athletes and team managing the athletes, we get a chance to go see the facilities, get a feel for the lay of the land, help prepare. So everything from their physical, mental, nutritional, spiritual health is all sort of being addressed in advance to give our athletes the best chance to succeed and try and win medals.
So what did you notice in Korea, Jim, when you were there?
Korea's fantastic. I mean, our last games were in Russia. I hope there's not too many Russians listening, but Russia, they probably would agree with me because I have a number of ex-Olympic Russian patients. Russia was a challenging country in terms of managing everything, and just the culture of the country is different from what we're used to. So Korea was a real breath of fresh air. I mean, the people are gracious, they're humble, they're smiling, they're competent, they're excited, they're motivated. I mean, it was everything. They're going to put on a fantastic games in 2 years, and they're well on their way to preparing. The construction is well on track, and you know, reminds me a lot of what Vancouver was like. I think they're very Canadian in that sense of how they're going to approach it. So I think the athletes really enjoyed. The venues were fantastic. The food was good. For anyone who hasn't had Korean barbecue, I've learned there's a whole bunch of great Korean barbecue places in Vancouver. So go out and try it out, and you'll learn how to use scissors when you cook food, which is a little bit of a different experience for most of us.
Wow. Oh man, so that must be a good feeling to know that it is going to be great for your athletes, and that there's really not any concerns that way, and you don't have to worry about pollution and stuff like that either.
You're right, and in fact, it's funny, before you go the first time, there's always a little bit of anxiety, familiarization with the place, what's it like, the roads getting there. So once you've been there once, you just feel totally comfortable with everything, the whole situation. We'll be back again next year for another test event, and then the games the year after. So by the time the games come around, it'll feel a bit like home.
Yeah, and I love the fact that you're wearing your shirt today, the Canadian Olympics sweatshirt today. It just kind of gets you in the mood. I mean, I remember our 2010 Olympics here, and just the energy and the because this whole series, by the way, is about good energy, right? And it feels great to be part of something, and being part of the Olympic team and kind of in that must just feel great. So when you put on your sweatshirt in the morning, it just must feel great to kind of be in that energy and excitement of excellence.
Yeah, you are part of the team, and it's remarkable what these athletes do. I think if anybody wants an inspiration, we watch them, but if one thinks about what they've gone through, and I watch what they go through and how young many of them are, a lot of them, certainly in my sport that I take care of, nationally, the snowboard team, a lot of them are teenagers, and 19, 20, 21, and they're on a world stage, all the stresses of trying to compete, all the excitement of success, all the challenges of failure. And Olympic Games are remarkable because you watch their dream disappear in a second. 4 or 5 years or a lifetime of training, it's gone, and you watch the devastation in their eyes and their face and disappointment. And then you watch them, as we get into another quadrennial, they pick up the pieces and they're right back at it again. They don't let that one moment define them in a positive or a negative way. Chris Hadfield sent a great tweet to the Olympic athletes in 2014 in Sochi about that. So don't think that you're going to be defined by your moment of your ski race or your snowboard race or your skate, that it's going to define you as a person. It's only just a moment. Very sort of profound words. And you see that really powerfully in these athletes, because a lot of them, it varies in their tools to manage that stress in the short term, and it's tough to stand by and watch them. For you and I, it's like our kids, or they're even getting younger than our kids now, And you feel like so much is thrust upon them, so much expectations that, it's amazing. We have to sort of help them work through it. And that's fun. And you see them get through it and they're stronger. For the athletes, they essentially have to do one games. It's really hard to go into your games, Olympic Games, the first time and succeed. It's so different that they need to have one experience of what it's like, and then they come back the second time, and that's when they can thrive at it.
Yeah. The that sort of sense of being in the moment and actually just picking it all up and then going again, it just probably great life training for anybody kind of going through something so refined, and then for life actually to get through with resilience. And you're speaking about these athletes that are stretching themselves. And yesterday in the paper, I was reading about Sharapova, the tennis player, and that she failed a drug test because she was taking meldonium. Is that right? The sport. Yeah. Can you talk about that?
Well, it is interesting. The athletes do, and they do really put themselves out there, and then we sort of assume that they're machines, and they're not. They are human beings with their successes, their failures, their worries, their insecurities. And there's a lot of pressure as you become bigger. And let's face it, Maria Sharapova, or whatever, $25 or $30 million a year she makes financially, there's a lot of corporate people and other people and voices in her head telling her different things. And it really is a challenge, and you're expected to continue to sort of perform. And then there's the cultural thing. Again, she's Russian. We know there's a lot of issues in Russia in terms of drug doping and use of medication. The medication she was taking wasn't banned December 31st, 2015. It was banned January 1st, 2016. That's because WADA looks at the list and they look at medication, says, is there a justification for a product? And if there's a medical justification, of course it should be allowed, because health is first and foremost. But if people are really using it for performance enhancement only, and there's a risk to it, that's when WADA says, it's not appropriate. And so this is one of those medications that's like that. Unfortunately, she's tried to sort of couch her use of it, at least what I read in the Vancouver Sun, by saying there was some medical justification, which, not knowing her details, I can't specifically speak to it, but I must admit I looked at it a little bit cynically and said, you're a fit, healthy 20-something-year-old. You really don't need to be taking a medication like that. I certainly can't imagine any of my athletes needing it for truly, purely medical reasons. You were using it as a performance enhancement, and it was legal until December, so nothing wrong with that. It was legal. Now it's not. You made a mistake and you sort of forgot about it, or didn't pay attention to a little detail. And unlike the rest of us, where we might know about it, you get splashed all over the papers all over the world, and has financial implications. And it's tough, because again, she's just another person like you or I. And, she's not a machine. So I'm sure it can't be easy for her dealing with it, and everything gets amplified.
Yeah, because she was saying it was about her magnesium deficiency and having an irregular heartbeat or something like that, and some sort of indication of diabetes. Is there any, does that make sense?
It doesn't to me, and I think sometimes the pattern for all these athletes is they're trying to somehow justify what they did. It would be actually refreshing if what I believe would be the truth, if she just said, listen, I was using this medication, it was legal, because I performed better with it, helped me perform. It's no different than people using supplements or vitamins or iron supplements, because all of a sudden, if they decided WADA was going to ban iron supplements, well, people wouldn't suddenly say, well, I was taking it for this and this. We have a lot of athletes who have what are considered medically normal irons, but need to take extra supplements because of the demands of their endurance sport. We know they perform better with an iron that's higher than what we would consider acceptable for the average person. So again, it would be refreshing. Just said, I was using it for that reason. It became, I made a mistake. I didn't realize it. And, it was only wrong when she took it after January 1st, because the body said it was no longer allowed. But she tried to couch it a little bit, which I think is a little unfortunate, because I don't believe she was using it for those reasons. There's other ways of treating those things that doesn't involve that medication. The first and foremost is, if it was that important of a medication, why is it not available in North America? of anywhere. The United States would have every product that is useful, that has some pharmaceutical company would want to make a profit off of marketing a medication if it was needed and helpful in the general population, yet it doesn't exist in North America. Why is that? So it makes us immediately wonder about what role it plays.
Yeah, I think there is a lot of pressure on the athletes, and it's a shame too if there's a mistake made. Just like you say, just own it and let's move on. Yeah. So I'm just wondering about for yourself. Jim, I'm always seeing you out running, and I know that you've done several marathons. And actually, I think Ashley and I, my daughter and I, we ran into in the New York Marathon. It was such a surprise, but I think you run every marathon. How do you keep yourself from getting injured?
Well, I don't. I actually have had lots of injuries, and I keep reminding myself that's what it helps me do my job. You got to go through the things your patients are going through to really appreciate what it's like. I've had injuries that have taken a couple years to get better. My problem is I try treating myself, and if patients knew how well I treated myself, they'd never come see me. So it's physician heal thyself doesn't work very well. So I have had injuries, and as we age, in fact, the most important predictor, I think, of not only enjoyment of what we do, but also success. And let's face it, all of us are, who run marathons are more sort of type A personality. We're goal driven, and so we measure not just by finishing, we measure by our times, our results. The most important predictor is health. And especially since we got day jobs and, we're trying to sort of manage the added stress of training, staying healthy is absolutely critical as we get older. And what that really means is, the good old days used to be able to just get up, throw on the running stuff, head out the door and go for a run. I can guarantee you my injuries I've had for the last couple of years, if I did that, I'd be injured in like less than a week. Again, by doing proper preparation before and after running, that's what keeps you, keeps me on the road, and that becomes more important as we age. And again, if I use the analogy of one watches how our elite athletes prepare, so the difference there is they're a lot younger than we are, but they're also putting demands on their body way harder. Some of my runners, they're running, 10 Ks in under 30 minutes. Well, you can just imagine how much stress that puts on the body. So it's all relative. So if they don't do their preparatory work, they're injured. And much like one of my mantras that I use with my elite athletes is I always tell them, and I tell this from the young kids, and this is a skill they need to learn as adolescents if they're showing potential. I always say to them, if you're not right on the edge of injury at all times, you're not training hard enough. But what the key art is never go over that edge, because as soon as you go over that edge, you are now counterproductive. And some athletes learn how to manage that well and others don't. And I see that right through the weekend warriors and the aging athletes. They just try to pretend it isn't happening and just bury themselves with a deeper injury rather than really managing it and doing all the preparatory work. Once they don't hurt anymore, they go, oh gosh, I don't have to do it anymore. They don't recognize what's going on.
So that edge you're talking about, Jim, do you mean like listen to your body and pay attention to, the squeaks that show up?
Yeah, absolutely. And then seek advice if you're not sure. See someone, whether it's a sports med doc, a physiotherapist, massage therapist, chiropractor, someone, family physician, someone who knows about injuries, and get some direction. And the other thing is people who've been doing it for a long time are better. And this is being well studied actually in the research. Doug and Jack, my mentors, they invented the sun run way back and somewhat successful with up to 55,000 runners a year.
Oh, I love that run.
It's the laboratory. It's like 5,000 laboratory rats. People don't realize, people out there who've run the sun run, you're a laboratory rat that we use for studies. So thanks very much. I'm one of them. I'm sure I know you are as well. And so what we've learned is that the highest risk for injuries are your brand new runners, first time runners. And I've done a number of talks for the Vancouver Sun Run on that. And the difference is they don't know how to listen to those signals. They're not sure what to do with them. And if it's their first time, they're just so committed to to running. They're emotionally committed as well. They've decided they're going to make some change in their lives. They're going to run the Sun Run, so they're going to run it come hell or high water. and then they get injured, and there's a lot, I often see a lot of emotional overlay when I deal with, you know, veteran athletes, recreational or higher level. They're very pragmatic. Well, if I can't do this race, well, then, you know, let's get healthy and we'll do the next one. The only time pressure being, for example, like right now with the, you know, with the Olympics coming up, there are deadlines, and they all realize that. You've been training for years, and the Olympic trials, for example, in track and field are in Edmonton in July. And if you don't perform on that day, there goes your Olympic dreams. So they're under a true time pressure, because in a way it's their job. Everyone else, they just got to learn, you know what, don't, you know, the Sun Run may be your dream, but the good news is it's going to be there next year, and there's lots of other 10Ks. And I often tell people, just back off, get healthy, and it's, you know, don't take it personally or put any more emotional value on the fact you haven't made it there. And welcome to the world that pretty much every one of us, I don't know anybody who hasn't had an injury at some point in time that's made them alter their plans.
Yeah, I think as I've got older, I've been thinking more about the actual participation in these events rather than the actual time. I really, at some point in time, I realized I was never going to be, you know, in the top, you know, 100 or whatever of any race. So I just kind of let go of that and started to just enjoy the sense of being, well, with my family quite often, or, you know, just with my friends, and just enjoying the music and the event itself, and that actually keeps me running, right? I mean, it's just is more about that than anything else. But you know, you're touching on something that makes me think of, you know, there's been a lot of controversy about the weekend warrior overtraining or becoming cardiotoxic. Can you talk about that?
For sure. I mean, you know, this is an interesting topic, and I think I should start by saying the real answer is we don't know. You know, like so many of these topics, I followed this. It's particularly a problem in Ironman, because, of course, one of the great things about people who do triathlons is you do 3 different disciplines. So because you're cross-trained, you can do more without getting injured. If anyone tried to run 15 hours, or most people, they tried to run 15 hours a week, they break down. But if they run 5 hours a week, cycle 6 hours a week, and then swim 3 hours a week, their bodies can take that increased load. So this tends to be an issue primarily within that population, not exclusively. And so those people typically are your triple type A personalities. No one does an Ironman who's completely laid back, and, you know, I mean, it takes a lot of discipline, a lot of time. So when you take that personality and all of a sudden there's a potential concern, it starts to get amplified. So, you know, first of all, it is real. And the issue is atrial fibrillation, which is an arrhythmia, irregularity of the heart that can occur in certain people. And we've recognized that there's a connection. Certain people who have been very, very fit develop atrial fibrillation. Akeem Olajuwon has gone very public. The basketball player used to play for the Houston Rockets, MVP. He had atrial fibrillation. You know, there are others who've gone very public with it. So we've made a connection. People who exercise a lot can get atrial fibrillation, or people exercise a lot and you get atrial fibrillation. Now the problem is, what's the connection between those two? How powerful of a connection? What does that mean to the rest of us? The BC Sport Cardiology Group under Saul Ishiro is actually doing a prospective study of following a bunch of aging athletes over time to see how common it is. These are people who have no problems right now, and try to follow it along and quantify what's going on. I've talked with the sport cardiologist that I work with all my pro athletes, Dr. Weiler from here on the North Shore, and he follows this very closely, because I'm back training. I'm running a couple marathons again this year, and this whole topic made me sort of take pause and think, gee, am I doing myself harm by sort of building back up to, you know, 70 to 100K a week of running, and so on. So I had a chat with him, and he basically, who's followed the literature as a subspecialist in sport cardiology, and says there's nothing conclusive yet that he said to me, for example, that I should not train and run and carry on. There's a cardiologist, and there's on the web that you can find a cardiologist from the States who's very dogmatic about, you know, one and done for marathons. His philosophy is do it, it's on your bucket list, never do another one. And I don't think most cardiologists, or I certainly wouldn't agree with that. Now, that's not to say, again, that there's a connection. Now, whether it's that someone has a higher risk for it who happens to be an athlete, we don't know. Or is it the athletics that leads to it? Jack Taunton, again, my mentor, who has developed, pretty significant heart disease, coronary artery disease, quite well documented before the 2000 Olympic Games, and had to have a quadruple bypass done the day after he was out for his routine 22-mile Sunday morning run, which is totally, we think there's no risk factors there. His sort of conclusion on it is the following. If you run a marathon, particularly if you run a marathon hard and you've pushed yourself and redlined it, you probably have, just like your muscles are sore, and this actually intuitively makes some sense. You know how we're always sore in our legs after the New York City Marathon? You remember it was wandering around.
Oh my God, I could hardly walk down the stairs to catch the subway with my girlfriends and my daughter. Yeah, it's just like, oh, yeah.
Let alone that curb. That curb as you cross the street suddenly becomes like a mountain. Okay, I got to step up that curb.
I know, that's right.
So we know our skeletal muscles are damaged after a marathon, and because we feel it. But what's interesting with the heart, it's a muscle as well. It's worked hard. We don't feel it, so we haven't really appreciated. Have we done some damage to it? So his intuitive take on it is that after running a hard marathon, we probably just need to go easy cardiovascularly for about 4 to 6 weeks, just to allow the heart to recover. And if we do that, that may protect it. Now, again, there's no hard and fast proof. That's more of an expert opinion on someone who's run like 80 or 90 marathons and has run like 120,000 miles in his career, and was a fast marathoner. He was like a 2.5-hour marathoner in his day. And obviously sports medicine academic, sports medicine leader. And that's his conclusion on that topic. So he's not saying, I talked to him as well. He said, no, I wouldn't say you don't do it, but after you do it, just give yourself a healthy break. And of course, so many people don't do that. They jump right back in as soon as their skeletal muscles feel fine, they're right back at it. So that's sort of the current thought on it. And
it's interesting too, because it's just like any muscle, right? The heart is a muscle, and it would make sense because in weight training, for instance, it's good to have the day off in between so that your muscle actually rebuilds and becomes stronger. Otherwise, you're constantly tearing it down, right? So that would make sense with the heart as well.
Yeah, so again, it's a topic that will be monitored. I've had a number of people ask of me about it because they're concerned, gee, am I training too hard? Should I back off? And there's absolutely no doubt in my mind, absolutely no doubt that it's way more problematic undertraining than overtraining. People who don't, so I wouldn't say to anybody, gee, back off, but I think if you're going hard and you do a race, a marathon or an Ironman, give yourself a good 6-week break. Celebrate your accomplishment and don't jump right back in. Let your body fully recover. Just train easy and stay tuned. We'll probably come back in 30 years. We'll probably have a better answer about it. Is there certain people predisposed to it? And that subgroup has to really monitor, and the rest of us, doesn't matter. We can do whatever we want. Because again, the reality is, while there are people out there with atrial fibrillations, there's stories like Jack Taunton's who had the bypass done. The reality is the vast majority of the people out there have had no problems whatsoever. And they've done a gazillion races. And I've got a number of master athletes in their 70s, 80s, and almost 90s that are thriving, having run multiple marathons per year. And so again, I think we have to put this topic in proper perspective.
Yeah, it makes sense. And can you talk about the VO2 max, speaking of oxygenated blood, and the impact in benefits to the brain?
So VO2 max in particular is a physiological measure. So if we think about, what happens when we exercise, everybody, listening knows that if you train more, you can go faster. If you go at the same speed, you don't have to breathe as hard, and you don't have to work as hard. That's the training effect. So one of the ways of measuring that is VO2 max. And in the simplest term, that's your ability to take oxygen from outside in the air and deliver it to muscles where it's used to move the body. And one of the things that happens with training is your capacity to absorb oxygen and use it increases. So that's why they use the word max, and volume and oxygen. That's where VO2 max comes from. So your lungs work better, your heart works better, your blood vessels work better, your muscles work better. All those things work better in order to be able to process oxygen. The brain part, I think, is a separate issue in terms of the benefits to the brain of exercise, cardiovascular exercise. And, one of the big buzzwords in sports medicine, and one of the things that you may have noticed, but I'll certainly point out, for example, is our national association. When I started, it was CASM, a Canadian Academy of Sport Medicine. We changed our name a few years ago, quite consciously, to CASM, which added an E before the M, which is now we're called Canadian Academy of Sport and Exercise Medicine. I now call myself a sport and exercise physician. The emphasis being that exercise is medicine, and there's a lot of work out there which talks about that. And simply put, if we were to almost like a metaphor and talk about exercise as a prescription, as a drug, it would be on the front page of Time magazine as the miracle drug, because there's pretty much not a body part that isn't benefited by exercise. And I challenge anybody to name me a drug that's developed by a pharmaceutical that is that powerful. So when it comes to the brain, for example, as you mentioned, it is profound. I mean, all our neurotransmitters in the brain, the oxygen in the brain, mood, anxiety is better. They've done studies compared to our SSRIs, compared to anti-anxiolytics, and that exercise is a great form of medicine. And so in that sense, there's many ways in which it helps the brain, oxygenation being one. There's work on, does it help stave off or slow down dementia, for example? So, I mean, it is profound. And I think we all sort of intuitively know that, because when we're all stressed out or tired, what's one of the tools we use? Some people will go and have a drink, others will go for a workout, and then
Yeah. Yeah, and it's all kinds of exercise, right? Any cardio, because I mean, we're talking running right now, but there's cycling, there's swimming, there's walking, for some, just brisk walking.
Yeah, absolutely. And simply put, what we're teaching our residents, I'll be doing a session with our family practice residents on exercise prescriptions. And we're using that metaphor because they're so used to prescribing a drug. You name the drug, you give the dosage, the frequency, and the duration. We're using the same thing with exercise. And the summary of it is really simple. And I ask every patient when I do a history on them in my general practice about I do an exercise vital sign, if you will, just like we take someone's blood pressure. People are always interested in their weight, what their pulse is, but we're also interested in what is their exercise vital sign. And by that, I'm asking how many minutes a week of cardio are they getting? And we just have essentially right now a good or bad threshold. And the threshold is 150 minutes per week of brisk walk intensity. And as you point out, it doesn't matter what exercise you're doing, as long as it's brisk walk intensity, minimum 10 minutes per session. And you want to do 150 minutes a week. And if we got everybody doing that, the pharmaceutical companies would be suffering, because the incidence of many conditions and use of medications would go down.
Yeah, absolutely. Every time I see a client, it's the first thing I ask is, I assess for how much exercise are you getting? So I do think it's such an important factor in mental health, as well as the physiological health. And, also for women who are pregnant, right, to be exercising in their pregnancy, and the impact and the research showing that, babies thrive, they've got, more ability to thrive in, and seen in their ability to latch with the mom, and there's long-term impacts as well to the offspring of parents who have exercised through pregnancy. So it's really interesting to see all of this research coming out, and it just is such an important part of our lives, as important as nutrition.
Absolutely. And I think one of the key principles everyone's got to understand is that, the second component of that, and this is what leads to a lot of injuries, is it's all about breakdown and regenerate, breakdown and regenerate. When we actually work out, we're breaking our bodies down. That's why our muscles are sore, and we've actually damaged them. And what's key is the regenerative process and that recovery process, because that's when we actually get stronger. And so the mistake a lot of people make is they feel like they got to do more breaking down. Oh, I got to, I'm not getting the results I want. I better train more. I better train more. And they don't understand that what the part of the equation isn't the stimulus of the amount of exercise breaking them down. It's the lack of regenerative component of it, making sure they're, as you point out, eating well, making sure they're getting an adequate amount of sleep, which I think is probably one of the most profound issues that gets under addressed in our society is, and I think by the next society, they're going to look back at our society on the lack on sleeping habits, like we look back our parents and grandparents on their exercise and smoking habits. And it's so obvious to us when we watch an old movie and see them all smoking and go, how stupid they were. They're going to look back at us and look at people on their computers late at night, lacking sleep, and how stupid were they in the early 21st century with what they did with sleep.
Yeah.
That's when you regenerate your body, regenerate your brain, and the more you train, the more you need it. To give a sense, everybody, of how important that is, again, if I can talk about our professional Olympic athletes, we engage the expertise of a chronobiologist with the work we do, because that's how important sleep is to performance. And the challenge a lot of those athletes have is they're traveling all over the globe all the time, so they're going through time zone changes, which can challenge them precisely at a time they've got to perform at their best. And if we can give them some better advice, maybe that gives our Canadians a bit of an advantage over others who don't pay attention to that detail. But for you or I, it becomes a critical part of it. And the principles about good sleep hygiene are absolutely critical to to sport and exercise medicine and maintaining health and maintaining performance.
Mm-hmm. So do you recommend, like, as a sleep hygiene routine, what would you say to your patients?
Yeah, I mean, there's, we've actually got some handouts. I'm lucky because I get to work with a fellow by the name of Charles Samuels out of Calgary, who works for COC, Canadian Olympic Committee, and a lot of our professional teams, and a fellow Ralph Mitzelberger from SFU, professor, does a lot of the research on this. And I really break it down to something really simple. And I just actually sort of really understood this just recently, is that what we look at, first of all, is quantity of sleep is our first factor. And we don't have to look at our quantity of sleep on any given night. That's not critical. It's over a period of time. So for example, just like with the exercise, I say you need 150 minutes per week. It's been well shown that can be 15 times 10-minute sessions or 2 times 75-minute sessions of exercise. It seems to get the same result in terms of health. With sleep, we want someone to get between 50 and 60 hours a week of sleep. How that adds up over a week probably is less critical. So those of us who sometimes had a late night or have to get up early, start stressing that I missed out on it, can relax. And as long as you make up for it on another night, it'll all average out. And so that's the first sort of idea. It doesn't have to be, 7.5 hours, 7 days in a row. It can vary. One night you might only get 5 for some other reason, but as long as you make up for it. Probably the single most important factor for setting our circadian rhythm is a wake-up time. And set wake-up time 7 days a week can be a challenge for those of us who love to sleep in on a weekend. But effectively for our bodies, if you sleep in 2 hours, you've just gone through 2 time zone changes physiologically. So people have issues. I get them to really be rigid on their wake-up time. Caffeine use. And what's interesting with caffeine is the researchers have suggested it's not just 4 to 5 hours. Some people can be up to 12 hours for them to completely clear the caffeine. So people have issues. I say after 11 a.m., no coffee. Others can go up till dinner time and do fine. But again, some people need to take a longer time. The room setup, it can be important, for it. And as I say, just trying to sort of relax in the fact that you don't have to get a perfect sleep every night, because especially as we age and our quality of sleep drops off, we know that is just not realistic. And then napping. For the elite athlete, we encourage them to have naps, but they got to be a maximum of 20 minutes, because if it goes any longer, again, it starts to mess our circadian rhythm. So people who are training hard and people who are working hard, which is a lot of us, we got day jobs and then we're training for things, and we're a bit short and a bit tired, having that 20-minute nap, set the alarm, make, literally, darken the room as if you're going to sleep and let yourself go into a deep sleep. And I mean, I've started doing that now at times, and you wake up after 20 minutes, the alarm goes off, and you go, whoa, where am I? And then it just freshens you for the rest of the day, and then it helps you complement what happens at nighttime. It doesn't impact your night sleep.
Yeah, and not getting enough sleep. Often we produce hormones called ghrelin and leptin, and it causes weight gain if you're not getting enough sleep. So it can actually correct weight problems for people as well, getting more sleep.
And what's interesting, there's a great TED talk on sleep by a chronobiologist from England. Really interesting name, just escapes me at the moment, but it's not hard to find. I recommend everybody to go watch it. Just Google TED Talk sleep, and he'll come up, the English, and I think there's a couple of them, but I think he's the only one that has an English accent, so it's easy to tell him. But one of the things he talks about, and I talk about to some of the athletes, particularly in those sports where it's a precision sport, I take care of all of our figure skaters. And figure skating is a very precision sport. It's all about doing that movement exactly right. So what I explain to them is that, and he talks about that, is during the night when we sleep, it's not just a passive time. Apparently Benjamin Franklin has talked, he's the one we have to blame about our attitude towards sleep. It goes back like 110 years. He thought sleep was a waste of time. If we could all just stay up 24 hours, imagine how productive we would be. What they learned is sleep isn't just a passive time, but actually the brain synapses, and we're reinforcing patterns of our brain. So for example, if an athlete trains for 3 or 4 hours during the day, a particular movement, for example, in the figure skating world, when they're on the ice and they're learning a new move, when they sleep that night, they are reinforcing the repetition they were doing during the day. And if they don't get adequate sleep, they actually don't lay down the pathways as well during the night. And I think we could apply this to learning and many other areas. So it just emphasizes the importance of it purely from a performance point of view as well.
Great. Yeah, and there's been a lot of, I'm sorry, there's an echo here. There's been a lot of information about head trauma lately, with the movie that's just recently come out, and just with our kids that are heading into sports. What would you recommend? Because I mean, there has been a lot of concern about the impact to the brain with football or soccer, with the head, and so what are you recommending for your patients to tell their kids or to guide their kids? What sort of sports would you recommend these days?
Well, I mean, I treat a lot of concussion in my practice, and in particular in the snowboard world, I have someone involved in the concussion constantly. There's always someone who's had a concussion, and so I see a lot of athletes with concussion. I think the first thing we can say is our understanding of the brain in 2016 is not great. Come back in 2116 and they'll look back on us and go, my gosh, they were in the dark ages back then. So first and foremost, there's a lot we don't know. And we see that by every few days. There's another article in the paper and the news media about some research suggesting, yesterday in the Sun talked about the structural damage to the brain seen on functional MRIs. So our knowledge is growing, but we have to realize that there's a lot we don't know right now. So we're starting from that position, but we have people doing these sports, and so what do we do? Well, if someone's really, really, really worried about it, and they don't like the idea of the unknown, I can tell you that in all the years I've taken care of tennis players right up to the professional level, I have yet to see a concussion in a tennis player. Mm-hmm. So it is certain sports, hockey, football. And interesting, I see a lot of concussions in the figure skaters and the ice dancers because they get knocked around. And interestingly, if one thinks about it, when was the last time you saw a helmet on a figure skater? And yet they're out there on the ice. And so many of my figure skaters in training will wear a helmet. They won't wear it in competition because aesthetically it's just not accepted, but they're hitting their heads pretty commonly. So in terms of concussion management, I think first and foremost, awareness, and that's what we didn't have 20 years ago. Unfortunately, NFL football, which is one of the main themes of the movie Concussion with Will Smith, is has set the bar pretty low for the medical profession and healthcare profession in terms of managing concussions. And some of what we see is almost a reaction to that. Not that I'm saying we can be overly cautious with it, but we got to put it in proper perspective. Many people have had, for example, I do a talk with the medical students on concussion, and I always start, usually there's about 20 in the room, second-year medical students, and I usually get a show of hands who's had a concussion, and almost invariably 25% of the hands go up. And then I say, how many have had multiple concussions? And usually 2 or 3 hands go up. So I say, let's think about this now. You all got into medical school, and I think it's still pretty darn difficult to get into medical school, and you've got to have a brain that works pretty well. So you all got into medical school, and you all look pretty well adjusted. You're here. Your classmates seem to like you. Why do we care about concussion? Doesn't seem to have had any impact on you whatsoever. And so I always start with that to sort of challenge them, what's going on. And the reality is we care about it because there's a subgroup of people where it can be a profound problem. And the challenge is, much like what we were talking about earlier with the aging athlete and the heart, we haven't fully been able to determine who falls into which group. It probably will turn out there's some people you can ram through a wall their head 1,000 times and their brain will be no worse off. They'll be fine. They will not get CTE. They will not commit suicide. They will not get Parkinson's. They'll have no problems whatsoever. There's many ex-NFL players out there living normal, healthy lives into the 50s, 60s, 70s, and 80s. So, but the reality is, as we well know, there's another group where it has profound impact on them in terms of their brain. And so since we can't distinguish those two groups, everybody gets treated the same at the beginning. We take them all as serious as ever until someday, if we can figure out a way to distinguish those two groups and tell group A, hey, we don't care that you hit your head, go back out. The old school idea of using smelling salts and putting them back in the game, send them back out there, and away they go, versus another athlete where we may say to them, you know what? I think you should retire from that sport, whether you're a young athlete aspiring to be a professional football player or you are a professional football player. You say to them, listen, this is not the sport for you and your brain. You have got to stop and stop now. We don't have that capability yet. We do use different tools to try to distinguish who is at higher risk, and we take a team approach with it. But there's no doubt that our ability to treat it right now in 2016 is woefully inadequate compared to where it will be in the future.
Yeah, I heard, I was at my book club last night, and a girlfriend of mine is a physician. She's talking about this new research around the myelination of the brain. And have you heard anything about that? And there's some hopeful new treatment for concussion.
Well, I have, and and I must admit, I read the article yesterday, and it's a classic researcher projecting into the clinical world. We've seen this in other areas of medicine. Structural and function don't always go hand in hand. That's the problem with that research. So it's interesting, it's profound, but I don't think anyone can make any conclusions whatsoever about what the clinical implications are of what they're seeing structurally. That's to be determined. And all of us who treat concussions will wait with great interest, because if it does turn out that is an issue, then it will change the way we manage it. But for them to say it should change the way we manage it right now is completely premature, because again, most people with concussions recover within 10 days and do not have any long-term consequences from it. I don't want to understate the importance of concussion, but that's the reality. Again, I speak about all those medical students who got into medical school after having concussions. So the challenge is that subgroup that don't do well, and will these new tools help us distinguish between those two groups? That's where it'll become more powerful. And obviously until then, what they're really preaching is we got to exercise caution. If there's any doubt, we got to be more cautious and protect, particularly the developing brain. Up until males, really their brain doesn't fully develop until they're about 25. Females at a slightly younger age, but we got to just keep that in mind, that we do have an onus to protect those brains. And if you think of the NFL, most of them are done by 25, 26. So that's why some of the damage in that subgroup can be so profound.
Right. Yeah, that makes sense. So, moving into just, generally speaking, what would you say is most important for men in terms of their health when it comes to, diet, exercise, or lifestyle? Like, what would be something to keep in mind for men?
I'm trying to think if there's any difference between men and women in a general term. I think everything we've been talking about, it's really balance. It's really maintaining health. The single most important thing is maintaining health. Exercising to the point of illness or injury, which many have done, doesn't make sense. Being accepting of the fact that as we age, our bodies need more time for that regeneration and recovery. Our tissues aren't as elastic, so they're more susceptible to injuries. We don't move as fast, so we just got to accept that we're not going to do things the way we used to. But if we do things right, we can thrive for a long time. I am just marveled, and one of the great pleasures in my practice are some of the elite world-class master athletes I take care of, and you're watching them into their 80s and 90s now, being world-class athletes. Betty Jo McHughes, who many of you people may know of, I don't know if you know of her, but she's from North Van, and she's 89, and she just in Hawaii in December, set the world record for the marathon.
Wow. Oh my gosh, that's so neat.
Anyone who's run who knows her, I've never seen her at a run without a huge smile, just like your smile right now. That's what her face looks like in the middle of a run. She is all smiles. She loves what she does. She thrives with it. She's just got a glow about her. She's got an amazing demeanor. She didn't start running until she was in her 50s, and she holds all the world records from about 75 on, every one of them. If you look it up, McHughes. She's written a book actually about it, and she's, I think she exemplifies everything all of us would dream to be. If I could be running marathons at 89 with a smile on my face out there in Hawaii, with my grandchildren or great-grandchildren, I mean, it doesn't get any better than that.
I plan on seeing you, we'll run that together. I think you're actually a few years younger than me though, Jim, but oh God, I would love to be able to do that at 89. That just is really inspiring to hear that.
So, her story is she still sets goals. I think I think she was 88. Actually, she was 88 in December when she ran it. So she thought afterwards, says, maybe I'll take 2016 off for Hawaii, and I'll go back in 2017, because then I can break the over 90 record for the marathon.
Do you know, and what you're describing with her is that she's got a long-term goal, and it's a reason for, for living, really. I mean, our grandchildren are reason for living, as we eventually, hopefully, we'll have some grandchildren to talk to my kids. But anyway, those things give us, reason for living, and it's nice having those goals, just because it does give you that focus and drive, right? It's just so neat to see that in somebody that's 89. So what you're saying though anyway is that there's not really difference between what men should be worrying about or versus what women should worry about. It's just generally, keep yourself active, stay engaged, eat well, get your sleep. Is that kind of
and be humble. If you can't do what you couldn't do before, just accept it. Don't get depressed. Embrace it. Do whatever preparatory work, whatever mobility work, stretching work you need to do before you do your activity and after your activities, and just recognize there's more maintenance. And the moms, they say to people, your warranty, unfortunately, has long since run out. And so you can't fall back on your warranty anymore. So you just got to be smart about it. And as we see from a lot of these athletes, I mean, the body can do remarkable things into our 80s and 90s. And there's many studies on that as well, when they've looked at deconditioned seniors and introduced like a strength and conditioning program to them. They still will have profound benefits from exercise all the way along. So there is no age limit where it all stops. Each individual has different issues. We age differently. We may have other medical conditions that may impact our ability to, to do things. So there are some situations where exercise may not be, fully warranted, and there may have to be some precautions. Heart disease is the most obvious one. Someone who's had a heart attack, they need to exercise, but they need to do it in a controlled way. But other than that, I think, yeah, stay healthy, listen to your body, do good maintenance, and enjoy it. Do it, do something you enjoy. I mean, it's got to be recreational as well.
Yeah, that social part is such an important motivator for many, and as people age as well, their social circles can shrink with some of their friends passing away. So the social stuff that comes from exercise is really a great way to keep you engaged. So I just want to ask you, and cross training maybe is probably a good idea too, right? Doing sort of cross training so that the body doesn't habituate to just the same thing.
Yeah, and if running's what you're doing, of course, running's a high impact activity, and that carries certain degrees of risks as well. So the cross training usually refers to non-impact or low impact. So you're cycling, swimming. That's why, again, the triathlons are so popular, because people who are cardio junkies can get their fix without breaking their bodies down by splitting up between all the activities.
Yeah, okay, great. And I just wanted to ask you, so as a doctor, what makes a great patient? What do you like to see in your patients that come in? How can they best partner with you?
Well, I think the engagement is probably the key word. They're engaged in their health. They're engaged in their bodies and their minds, and they're motivated. And that's one of the things I love about the sports, the sports medicine world. When I see them, most of those people are engaged. In fact, that's what drives some family docs nuts, because they don't know how to control or manage or focus that enthusiasm, if you will. Someone comes in and they say, I can't, I keep hurting when I run. So the patent answer is, well, don't run anymore, which of course they don't want to listen to. Whereas I'd say, okay, well, let's look at it. Let's look at your injury, and maybe temporarily you have got to stop running. And I see that many times, because you just got to give your body a chance to heal, and then let's get you back running. So we got to manage it. So I find that I can use that engagement, that enthusiasm quite effectively by educating them and then empowering them with the knowledge, and say, okay, here are the things to watch for, and here's what you do about it. And again, some people do it well and they listen to it and they thrive, and others choose to ignore it and they don't do so well. And eventually most of them do come around and learn and listen to their bodies. And those people, they're hungry for information. They're hungry for knowledge. They want to sort of understand things and then apply it. Goal setting, I think, is big. And for a lot of us, when we don't have a specific goal, I'm certainly like that. Training for Vancouver Marathon and Berlin Marathon this year has totally got me focused. When I'm not training for something, I don't have the same focus. It's easy to fall off the wagon and not do something after the seminar. I've got a 3-hour run coming up. I wouldn't do that if it wasn't, if I didn't have the race. I'd go, oh, I'm a bit tired. I'd rather go, get some other work done. But you know what? I got to prepare for the race. And once I get out there, I'll love it. So I think having goals, and realistic goals. But the other key point that people should have is flexibility, because maybe those goals will get disrupted by, could be anything. At our age, anything could happen. Something with, a lot of us have elderly parents who suddenly get ill. We have siblings who suddenly get ill, kids whose demands are needed, and our goals have to be put aside, and we have to be flexible to put them aside, and then just retool and plan a different goal. Injury can get in the way, and as we talked about with the Sun Run, well, good news is as a lot of these events occur every year. It's not like the Olympics where it's every 4 years, and you don't get an automatic entry into the Olympics. You got to earn it. Most of the things we're doing, you don't have to. You can get into it again and again and again and do other events. So there's no shortage of events.
Yeah. You just always strike me, Jim, is that in medicine, it's actually become so busy and pressured, actually. But for you, you always see the whole of the patient, right? I mean, I really hear that. And as you're describing what makes a great patient, you're actually looking at a whole picture of what the patient really, what makes them happy, like what fitness goal they might have that would bring them joy. And you're sort of thinking about treating the person and not the disease. And I think that's such a great model for medicine these days, that physicians, have the opportunity to enjoy their job more when they do take a chance to kind of think about the big picture of the patient that's coming to see them and treat the human being that's there, not the disease, you know? And I'm just wondering, how do you stay so inspired? Because, you know, you've consistently, I think, know you now 35 years, and you've always, you know, on it. How do you stay so inspired?
Well, you know, I think it's because I was just talking about with my family this morning when I was having breakfast, and you know, and I can only talk about medicine because that's what I work in. It is such an evolving field. I mean, that's one may ask the question: why do we talk about practicing medicine? We're always practicing. We never perfect medicine. There's not the perfection, it's always practice, which means we're always evolving. And, you know, even after, you know, over 3 decades of doing this job, I'm always learning new things. And that's what makes it interesting. And the fact that you're always meeting new people, and I get a great joy out of helping people help themselves. And so it's self-fulfilling. There are disappointments for sure, people who you can't help. And, you know, sometimes I have to remind myself it's their lives, not mine. And all I can do essentially, and all I really am, is an expert opinion. Whether people choose to listen to me and follow my advice is not something I'm going to take personally. It's something I'm going to give them what I think is the right advice, and they're going to choose whether they want to listen to it or not, or go somewhere else. And I'm not going to take it personally if they do that. One of the great joys I have with the elite athlete is I get to work within a team. It's very much not a vertical model of the traditional model, say the doctor at the top and work your way down. It's a horizontal model that consists of what we call the integrated support team. And that's the model we have with all the groups, whether it's Tennis Canada, the Whitecaps, the snowboard team, the BC Endurance Project. And, you know, it consists of a doctor, a physiologist, sports psychologist, and then the coach technician is your core group. And then around that, supported by a nutritionist, chiropractor, massage therapy, biomechanists. You know, you have the whole team, you know, chronobiologists, general psychologists, that are all part of the team. So it's just a pleasure, because when you sit around and discuss a particular athlete, you know, when you go around the table, I'm forever going, wow, boy, you know, I'm so lucky to surround myself by such smart people, because they got great ideas and perspectives, and then that leads to the benefit of the athlete. Now, we do that with the recreational athlete in my office. It's just that we don't sit down all in one room like I do with the elite athlete. So they may go see a therapist, and the therapists I work with integrate very closely with me. We're in communication back and forth all the time as needed to help manage the patient, and they may be going to someone like you for part of their health issues. And, you know, we've talked back and forth and we work together. So that integrative approach makes a lot of, you know, a lot of fun. You know, we don't just work in isolation. It's not just, you know, because I'm a doctor, I'm at the top of the pyramid. It's, you know, I'm a doctor, so I'm part of it. I'm just another member of the team that will bring a perspective.
Yeah, it's the way, actually, this whole sort of Shine in 2016 series is, you know, kind of the momentum behind it is to create a collective of, you know, so that people have greater access to, you know, really stimulating ways that we can stay healthy in our lives, and keep the people that we love, you know, healthy as well, and inspire them. So, yeah, thank you. That just is, you know, that just sort of says it all, and really captures the essence of who you are, Jem. I just am so, you know, just consistently wowed by you. You're very inspiring. Yeah, and just humble too, right? I mean, you're just, yeah, you really are somebody who is working with the team. And okay, so before we run out of time here, I just wanted to, we did have a question from Glenn. So a question from Glenn for you. He says, I'm a cyclist and I'm going to do the Vancouver to Whistler Grand Fondo in September. And can you ask Dr. Bovard how to figure out how much to eat and drink while riding, especially on longer rides?
Yeah, that's a great question. And I think the first thing is that's something you need to determine in advance, obviously, which is why Glenn's asking the question now in March and not in September, the night before the race. And the answer is it varies from person to person. So, you know, that's something that Glenn needs to sort of determine over time as he's doing his longer rides and testing out the nutrition, because there's a number of factors. I mean, we need to fuel ourselves, if we think that way, and our fuel consists of liquid and then calories and then electrolytes in the simplest terms. And getting the right balance of those varies from individual to individual. So there are general guidelines in terms of how much fluid you need to drink, what kind of calories. And then the problem is, the other variable is the weather on the day. I don't know anyone who's listening or trying, if you remember last year when they had the Ironman Canada at Whistler, we had a ridiculously hot summer, as we all know, incredible weather. Everybody was training for heat, preparing their self for heat. Day of the race, it snowed. And people were having to pull the race from hypothermia day, because it was a downhill ride from Whistler down towards Callahan Valley. And they just come off the swim, they were a bit wet, and there were a bunch of people who were hypothermic. So again, on the day, that's the problem with an outdoor activity. You just never know what it's going to be like. But again, it's just trying to sort of get a sense of it, how the body feels. Because if you're under fueling, you'll notice it in performance, and you later on. So you've got to figure out how much you need. If you over drink, you're gonna have to pee a whole bunch of times, which is not good either. You want to find the right the right balance in there. So it's hard to give a specific number, but it's more of a process. Trying different amounts of fluids, what each individual finds things they like. Some people like Gatorade, some prefer water, some like using formal gels, some hate gels, and they'll use other things. A lot of the triathletes, their favorite drink is Coca-Cola. Good old-fashioned Coca-Cola. They flatten it out. And others can't stand the thought of that. So again, there are general principles of how many grams of carbs you need per hour, and I can't remember the exact number, but it's certainly out there in the web. And those are guidelines. So you take those guidelines and then you experiment during your rides. So while you're also training your body muscularly and lungs and everything else, you're also training your nutrition and fluid needs as an individual, and then applying that on Fondo Day.
Thank you, Jim. It's great. Yeah, and Glenn, by the way, I should also mention that if you refer back to session 1 of Shine in 2016 with Diana Steele, she talks a little bit about that, and you might find some information there as well. Jim, thank you so much. And, just, wow, so many great ideas today. And I'm sure everybody that's listening in is, taking notes. And anyway, thank you to you and all of the speakers that we've got through the Shine in 2016, all about your good energy. And just, realizing our time, we're out of time. Just want to say that next week, though, we've got Nico Luce. He is the co-founder of Y Yoga, which now I think is right through Vancouver and Toronto. I think there's like 26 or something facilities. They started with one here in Vancouver, and the inspiration for him came from India. So you'll find out more about how to be innovative in your career. So moving from Joni Marr, when she coached us about your career and reinvention, then Nico Luce will take us into how do you actually actualize a dream that you might have. And so I'm really looking forward to sharing that session. It'll be pre-taped, so you'll get the replay at 10 o'clock next Wednesday. And Jim, thank you so much. You are just, you're a living, breathing inspiration. Thank you so much. And I just want to go out and go for a run right now.
Thank you, Joanne. You're an inspiration as well. Keep up the great work. We all benefit from everything you've done, right back to our mum-me days in the 80s. I remember well.
Thanks. Yeah, I think actually, we did a session on a local show, didn't you? Anyway, yeah, that's many years ago. But anyway, it's great to do this with you today. Thank you so much.
My pleasure. Take care.
Yeah, you too. Bye.
Bye.